A health system is a combination of structures, processes, and resources required to deliver health care to the population. According to the World Health Organization, a good health system delivers quality services to all people when and where they need them. The exact configuration of services varies from country to country, but in all cases requires a robust financing mechanism, a well-trained and adequately paid workforce, reliable information on which to base decisions and policies, and well-maintained facilities and logistics to deliver quality medicines and technologies. Most low and middle income countries are striving to provide equitable healthcare to their population, mainly because of issues of access to care and maintaining the quality of health services. In rural regions of Africa, India, China, and South America, hundreds of millions of people go their whole lives without even seeing a doctor. They may have access, though, to a village healer using home-brewed remedies that may or not be effective against disease. Only developed industrialized countries, perhaps 40 of the world's 200 countries, have established healthcare systems. Most of the nations on the planet are too poor and too disorganized to provide any kind of mass medical care. The basic rule in such countries is that the rich get medical care, the poor stay sick or die. The quality of services gets compromised due to lack of or delay in the availability of information to make appropriate clinical and administrative decisions. Working supply chain mechanisms, and access to care and information for communities. All this leads to high morbidity and mortality in these communities, especially those in the poorest settings. An important reason for these gaps is the lack of data collection mechanisms available for community-based health providers and peripheral health facilities. With the current and growing penetration of mobile phones in low and middle income countries, and lowering costs of services, mobile solutions can help provide sustainable solutions to address this gap. A number of small to middle-scale initiatives have already been implemented throughout the world, producing useful evidence for behavioral change in the community and decision support for health providers using mobile phones. There is a need for more evidence showing improvement in health systems through better information, supply chain mechanisms, access to care, and business models. mHealth solutions have been used to capture first-hand information from the communities and reach decision makers in no time. Many remote health facilities have used mobile technologies to report the status of supplies at their health facilities and sending demands for essential drugs. Mobile-based telemedicine and decision support systems have shown to enhance capacity of health providers in rural populations. mHealth has also provided options for mobile-based savings and payments at the time of care. There is also a need for evidence to show the impact of using mobile solutions to achieve equitable health systems and improving health status of the population. The evidence will help develop more scalable mobile solutions for strengthening health systems for low and middle income countries.